Hello and welcome back to my channel, Mental Health with Melissa. My name's Melissa. If you're new here, please don't forget to hit that like and subscribe button for more content. I post new videos every single Sunday and Wednesday, and subscribing to my channel really helps me get mental health information out there to our communities of color, and tons of free LCSW test prep for those that are studying for the LCSW exam. And I have an LCSW test prep study program coming out for purchase starting March 31st, so in a few weeks, and it's called Social Work Study with Melissa. Head to the link in the description box below if you're interested in that. It's taken me quite a few months to get all of the information together, and I'm very proud of it because there's tons of information that you need to know for the actual test. The way that I set up the study program is very similar to the way that I do my teaching on this channel, so if you found that the videos on here are helpful, then there's a similar sort of teaching dynamic for my study program with private videos for those that purchase it, an actual study exam outline, and then a mock exam with 170 questions. So definitely stay tuned for that. Alright, so this is the second part of the last video, which was on different anxiety disorders. So make sure that you take a look at that and just make sure that you have a general idea of the different differences between the different types of anxiety disorders. So now we're going to go ahead and get into the actual LCSW test prep question. Okay, an outpatient clinic social worker receives a referral of a 37-year-old patient with complaints of nervousness, sweating, difficulties staying asleep, and inability to concentrate for the past month in any given situation, both alone and around others. The medical provider clears the patient with no acute medical concerns. The patient can likely be diagnosed with which anxiety disorder in the DSM-5? All right, so if we're remembering the information from the first part of this video, again, I'm really going to recommend looking at that video or watching that video first, because if you don't know anything about any of these diagnoses, then there's probably just going to be the guessing game. And with the multiple choice questions, we really don't want to play the guessing game. We want to have an idea of what these diagnoses mean, and the only way to do that is to watch like kind of the first parts of these sorts of videos that I do, where there's more information and psychoeducation on what these diagnoses are and some of the criteria. So option A, agoraphobia. Agoraphobia is when somebody has this extreme fear to be in public places or in crowded places, like on the bus or in a restaurant or at a concert or standing in line. And so that doesn't sound like, because with agoraphobia, it's very specific to that, and it makes it very difficult to leave the house. So that doesn't sound like what's going on in this particular situation, because it says in any given situation. It's not limited to being in groups. So because of that, we're going to go ahead and cross that off. Option B, generalized anxiety disorder. So these symptoms are all symptoms that happen with generalized anxiety disorder: sweating, nervousness, difficulty sleeping, inability to concentrate. So those definitely meet the criteria for generalized anxiety disorder. Let's keep looking though. Social anxiety disorder. So social anxiety disorder is only around other people or in public speaking, and with this it says specifically in any situation, so around others and alone. So because of that, and it not being limited to being in a social gathering, this is not going to be the answer. And option D, unspecified anxiety disorder. Unspecified anxiety disorder, so one of the main differences between unspecified and generalized is the time frame, right? So the generalized anxiety disorder, the cutoff is 6 months. So it has to be present. These symptoms have to be present for 6 months or more in order for it to meet the criteria or the diagnosis for GAD. Otherwise, anything else will be unspecified. So let's take a look here. It says that the symptoms have been present for a month. So it's only been around for a month. And also, this is the social worker's first time meeting the patient. So because they just received their referral. So usually with unspecified anxiety disorder, this is used in environments or in situations where the patient is new or the provider does not know the extensive history yet of the patient. So for that reason, option B is out, and the answer is going to be option D, unspecified anxiety disorder. All right, thank you so much for watching. Again, don't forget to hit that like and subscribe button. Until next time, managing mental health matters.